widespread drug use in public places,
Just humming around.
the growth of homeless encampments, fears of the potential for crime. It's all got many Canadians looking for solutions to the drug crisis. And some are wondering, is forcing people into treatment the way to go?
The answer to addiction and public safety is not more drugs or ignorance or looking the other way.
There are individuals who are on the verge of fatality that desperately need treatment.
So the idea is gaining political traction in Canada, but does forced treatment actually work? Well, the evidence is far from clear. For some people, it feels like their only hope. It's what Luana Laurison desperately wants for her daughter.
I don't want to lose her. And I don't want to lose her and her become a statistic.
Laurison's adopted daughter, Elithle, is 22. She has fetal alcohol spectrum disorder and got addicted to drugs in high school.
I think if something like involuntary care had been in place 6 years ago, my daughter wouldn't be where she is right now. She wouldn't be emaciated. She wouldn't have been assaulted. She wouldn't have burns on her body.
Laurison often has no idea where her daughter is.
She's a slave to the addiction. That's what's running her life now.
She has repeatedly written to BC's Premier, begging for a way to force Elithle into treatment.
There are only two outcomes for my daughter that I can see: recovery or death. And since she can't choose recovery, I think it's our responsibility to do that for her.
Right now, under provincial mental health acts, someone can be forced into psychiatric treatment if a doctor deems them a danger to themselves or others. Under the criminal code, the courts cannot force anyone into drug treatment, but can offer it as an alternative to jail. Here in Alberta, the government is promising legislation to allow for involuntary treatment. It's also creating 10,000 new detox and addiction recovery spaces, the biggest expansion in North America.
What's happening in Alberta is being looked at around the planet.
Marshall Smith is a key architect of Alberta's plan.
Everything about the Alberta model is really geared towards getting people off of drugs.
He was chief of staff to Alberta Premier Danielle Smith, no relation. 20 years ago, he was addicted to methamphetamines.
I gave up my suit and tie at the legislature in British Columbia where I worked at the time and vanished into the downtown east side of Vancouver, where I lived as a homeless addict for about 4.5 years.
Smith traces his own recovery to an ultimatum he got from the police.
They essentially told me, go to treatment or go to jail. I picked treatment, and I haven't looked back since.
The Alberta government plans legislation to pave the way for forcing people into treatment without a criminal conviction, something Smith supports.
Is it better to have involuntary care or to allow somebody to languish in a tent shooting fentanyl in their neck under an overpass with the threat of dying? I would say it's more effective than that any day of the week.
But what does the research actually say about the effectiveness of forcing people into treatment? Just last year, a task force of Canadian addiction medicine specialists reviewed 42 studies from around the globe. Their report found a lack of high-quality evidence to support or refute involuntary treatment.
The scientific evidence to support this as an approach, as an effective approach, just simply isn't there.
The comment I heard most often from experts about forcing people into treatment, well, they said governments must first make sure there's enough treatment available for those who actually want it. Dr. Katie Dorman has worked in the addictions field for much of her career.
For years, I saw that people died waiting for treatment. Residential treatment is very difficult to access. There are so many barriers, and people could be waiting 3 to 6 months. They can be waiting 12 months for a program that's appropriate and safe for them.
When you hear politicians talking about forcing people into involuntary treatment, what comes to your mind?
I mean, I think it's absurd that we're talking about forced treatment because people who want care can't access it.
Here on the front lines of the drug crisis, forcing people into treatment is not on the agenda.
We want to build trust. Trust is huge. Our clients are quite marginalized and they've come from traumatic and hard lives. And trust is key to start with in building these relationships.
In Hamilton, Ontario, the police lead a team that includes social workers and addiction specialists.
Is there anything else that you're kind of looking for in terms of support from our team?
An approach the team members say better reflects the realities of drug addiction.
I want people to understand that these are human beings that have come from traumatic and hard lives, and you need to meet them where they're at.
When you're ready for that treatment and you want that treatment, it's much more successful than forcing it on someone.
There it is.
That's a view shared by Emily Ranft.
Okay, I can help you find the other ones too.
A decade ago, when she was living on the streets of Kingston, Ontario, Ranft was involuntarily hospitalized several times.
Getting bad when I was 19 years old with mental health issues and as well as substance use. My whole life wrapped around using substances, and I was making a lot of unsafe decisions.
Her perspective on being forced into treatment?
It didn't work. It just made me and my parents strained our relationship even more.
This and all these.
Okay.
What Ranft says actually made the difference for her and spurred her to get clean, learning that she was pregnant with her son Cedar, who's now 4.
It was the catalyst to my change, and that I had to make that either I continue on in this way or I have to choose to live again, really. It was choosing to live. If you force treatment but everything stays the same, that's not going to help people.
As the debate over involuntary treatment goes on, the drug crisis continues to ravage communities across Canada and leave its toll on people like Luana Laurison.
I feel helpless, and sometimes I feel like giving up.
Despite that feeling, she keeps going with her quest to get help for her daughter.